Have you ever felt a sharp, burning pain in your foot, particularly between your toes? If so, you might be experiencing the uncomfortable symptoms of Morton's neuroma. Morton's neuroma affects the ball of your foot, specifically between your third and fourth toes. It's characterized by a thickening of the tissue around a nerve, creating a painful, swollen sensation. This nerve, called the interdigital nerve, runs between the metatarsal bones of your toes, and when it becomes irritated or compressed, it can lead to Morton's neuroma. This condition is more common in women than men, often associated with wearing high heels or tight shoes. Understanding its development, symptoms, and treatment options can help you find relief and get back on your feet comfortably. To understand Morton's neuroma, imagine the nerves in your feet as delicate pathways transmitting signals to and from your brain. When these pathways are subjected to repeated pressure or irritation, they can become inflamed and thickened, leading to the formation of a neuroma. Several factors can contribute to the development of Morton's neuroma. One of the most common culprits is wearing shoes that constrict the toes, such as high heels or pointed toe shoes. Activities that place repetitive stress on the ball of the foot, like running, dancing, or playing court sports, can also contribute to Morton's neuroma. The constant pounding and impact can irritate the nerves, leading to inflammation and, eventually, the formation of a neuroma. Individuals with certain foot structures, such as high arches, flat feet, or hammer toes, may be more prone to developing this condition due to altered biomechanics and pressure distribution in the foot. Morton's neuroma often announces itself through a variety of uncomfortable sensations in the ball of your foot. Imagine the feeling of a pebble stuck in your shoe, except you can't seem to shake it loose. That's a classic symptom. The pain typically resides between the base of your third and fourth toes and can range from a mild ache to a sharp burning sensation. As the condition progresses, you might experience numbness, tingling, or a pins and needles feeling in the affected toes. Walking can become increasingly difficult, especially in shoes that compress your toes. The pain might come and go, flaring up after prolonged standing, walking, or running. You may find temporary relief by removing your shoes and massaging the affected area. If you suspect you might have this condition, seeking early diagnosis and treatment is crucial to prevent further complications and alleviate your discomfort. Diagnosing Morton's neuroma typically involves a combination of physical examination and sometimes imaging tests. Your doctor will start by discussing your symptoms and medical history, paying close attention to your descriptions of the pain, its location, and any activities that seem to trigger it. During the physical exam, the doctor will examine your foot, feeling for any tenderness, lumps, or thickening between the metatarsal bones. They may also manipulate your foot in various positions to reproduce the pain or assess your range of motion. These maneuvers help pinpoint the affected nerve and rule out other potential causes of your symptoms. In some cases, your doctor might recommend imaging tests to confirm the diagnosis or rule out other conditions. An X-ray can help visualize the bones in your foot and exclude fractures or arthritis as potential culprits. The good news is that Morton's neuroma can often be effectively managed with conservative, non-surgical treatments, especially in its early stages. These approaches aim to reduce inflammation, alleviate pressure on the nerve, and relieve pain, allowing you to resume your daily activities comfortably. One of the first lines of defense is making simple yet effective changes to your footwear. Opt for shoes with a wide toe box that allows your toes to spread naturally, avoiding anything pointy or constricting. Low heels or flats are preferable to high heels as they distribute your weight more evenly across your foot. Your doctor may recommend over-the-counter or custom orthotic inserts to provide additional support and cushioning to the arch of your foot, reducing pressure on the nerve. Rest is essential, especially after activities that exacerbate your pain. Applying ice packs to the affected area for 15 to 20 minutes at a time, several times a day, can help reduce inflammation and numb the pain. If non-surgical treatments haven't provided sufficient relief, your doctor might suggest minimally invasive procedures to target the inflamed nerve directly. These procedures are typically performed in an outpatient setting, meaning you can go home the same day. Corticosteroid injections are a common minimally invasive option for Morton's neuroma. Corticosteroids are powerful anti-inflammatory medications that can effectively reduce swelling and pain. During the procedure, your doctor will carefully inject a small amount of corticosteroid medication directly into the area surrounding the affected nerve. Another minimally invasive option is alcohol sclerosing injections. This procedure involves injecting a solution that damages the nerve, interrupting its ability to transmit pain signals. Your doctor will discuss the potential risks and benefits of each minimally invasive treatment option, helping you make an informed decision based on your individual needs and the severity of your condition. In cases where conservative treatments and minimally invasive procedures haven't provided satisfactory relief, or if the neuroma is particularly large or causing significant pain and disability, surgery might be considered as a last resort. The goal of surgery is to remove the pressure on the nerve, alleviating pain and restoring normal foot function. Neurectomy is a surgical procedure that involves removing the affected portion of the nerve. This procedure is typically performed through a small incision on the top of the foot. While neurectomy can effectively eliminate pain, it can result in permanent numbness in the area previously served by the removed nerve. Decompression surgery is another surgical option for Morton's neuroma. This procedure aims to relieve pressure on the nerve without removing it. It involves cutting nearby ligaments or structures that might be compressing the nerve, creating more space for it to move freely. Your surgeon will discuss the most appropriate surgical approach based on the size and location of the neuroma, your overall health, and your activity level. While not all cases of Morton's neuroma are preventable, there are steps you can take to minimize your risk and keep your feet feeling their best. One of the most crucial steps is choosing footwear that promotes foot health. Opt for shoes with a wide toe box, good arch support, and a comfortable fit. Avoid high heels or shoes that squeeze your toes together, as they can put excessive pressure on the nerves in the ball of your foot. Engaging in regular foot exercises can help strengthen the muscles that support your arches, improving foot mechanics and reducing stress on your nerves. Simple exercises like toe curls, marble pickups, and calf stretches can make a big difference. Maintaining a healthy weight can also reduce pressure on your feet, lowering your risk of developing foot problems like Morton's neuroma. By making foot-healthy choices and incorporating preventative measures into your routine, you can significantly reduce your chances of experiencing the pain and discomfort associated with this condition. Morton's neuroma can be a painful and debilitating condition, but with proper understanding, diagnosis, and treatment, you can find relief and get back to enjoying your favorite activities. Remember that early intervention is key to preventing further complications and achieving the best possible outcomes. If you experience persistent pain or discomfort in the ball of your foot, don't hesitate to seek professional medical advice. A qualified healthcare professional can accurately diagnose the cause of your pain and recommend the most appropriate treatment plan for your individual needs. By prioritizing foot health, making informed choices about footwear, and seeking timely medical attention when necessary, you can take charge of your foot health and maintain an active and fulfilling lifestyle.